everyone, and welcome to the Arthritis Action podcast. My name's Mark. I'm the area coordinator for the charity, and as always, your host. Joining me on today's episode is David Vaux. David is the Therapies manager and exercise lead for the charity, and here to talk all things pain with us. So, hello, David.
Hey, mate. How you doing?
I'm good, thanks. I'm good. Thank you very much for joining us today.
It's a pleasure.
As we've done with quite a lot of these already, if we could start off with, if you could tell us a little bit about yourself and your role with the charity.
Sure, yeah. Well, as you've mentioned, I head up the Therapies offer that we have at the charity, which historically has been more focused on the associate practitioner network. As members will probably know, that means a national network of clinical experts, really, in musculoskeletal medicine. But latterly, we've been also focusing on other therapeutic options, so around exercise, both in person and online, and using technology. And as you said, I'm also in charge of our activities and exercise strategy, I guess you would say. So, and again, that's been great because, as you experienced yourself, Mark, we've been collaborating and partnering with other organisations to create exercise apps for people with musculoskeletal conditions. And so I spend my time, half my week working with Arthritis Action and half my week working with patients in clinic, where I try to practice what I preach, really, and also what we preach at the charity around, lifestyle and exercise prescription, specifically for arthritis, to manage pain, and hopefully to complement, what else they're doing via their medical routes of treatment as well.
Excellent. Sounds good. Also, should anyone want any more information on a bunch of things you mentioned there, like the Associated Practitioner Service or the exercise apps that we work with, that's all available on our website as well, so you can go and learn a bit more about it there. To get back to now about pain and arthritis, I mean, that's obviously something that I think the people who listen to this podcast or are our members or access any of our services will always want to know a bit more about pain, as it's something that lots of them are going to be affected by. So, I mean, why does arthritis cause pain in the joints then, sort of to strip it down to like quite simple roots?
So firstly, pain it's a bit of a dichotomy, because it is often simple, but often it can be when we deep dive into the nervous system, which ultimately we have to when we talk about pain, it can get quite complex. But fundamentally, pain is there to tell us something's going on. We've all probably experienced sitting in one position for too long, and something starts to ache slightly on a very trivial day-to-day level. That's your pain pathway telling you probably time to move because you've not got enough blood in that muscle. On the other end of the scale, when you have an injury, the classic stub your toe or hit your thumb with a hammer, pain is there to let you know you don't want to do that again, or you might want to put the hammer down. I think the thing is with pain that we must all realize that it is often referred to as a skill that you don't want to learn. And what I mean by that is, if you have it for too long, then we become really, really good at creating it and feeling it in a nervous system, more so than someone who hasn't had long-term exposure to pain. And in many ways, just like learning how to do other skills, our nervous system is neuroplastic, which means it can learn how to do things more easily if exposed to things. And sometimes people kind of recoil at that suggestion, but it's not that we want to learn that skill, it's that we have no choice. If we're exposed to pain for a long time, then we become easier for people who are exposed to it to actually create that pain within the nervous system via stimulation. So for instance, I work with some people that just stroking an affected area with a very light touch when you're palpating for an injury can be truly painful for them. Whereas someone who hasn't had long-term exposure to pain, that wouldn't be painful for them. And it's real pain because it's mediated and facilitated by the ascending and descending nerve pathways, and ultimately the brain, where we pick up those triggers have accumulated and culminated in us having real pain. So I bring that up because I think it's a useful starting point when we talk about pain, because when we talk about how to do something about it, the starting point's always got to be an understanding of what's actually going on. And I think once we realize what's going on, we realize we're not going mad. Often people are told that pain is all in their head. Well, actually, to a point, that's true.
Yeah.
And to another point, that's not true, because to a point it's true because, if we're talking about the brain, that is in our head. But if we're talking about something that's imagined, then that's incorrect. Pain for a source that you feel is real. It's not imagined. It's a biological, neurochemical reaction that's happening. Now, with that skill thing that I was mentioning, Mark,
Yeah.
what we need to understand is that we can also learn ways of taking side roads around that. So what I mean by that is, if we move in certain ways, if we find ways of moving our joints that would normally be painful in ways that don't trigger pain, the more we can do that, then the less skillful we become at feeling pain. So, for instance, that's why water therapies and just walking in water or unweighting yourself in those circumstances and moving your joints around are very good, because what it does is it sends a message to the brain that I can move this joint without it being painful.
So that is actually possible then, to unlearn, like, as you're saying, like how it, like,
you can unlearn it. It does take a long time, but it is absolutely possible to improve your experience of pain. I'm not saying that everyone can be pain-free.
of course.
But what I can say is you can take it from a 7 out of 10 to a 3 out of 10. I see that in clinic happening regularly, and I think it just depends on the approach that you take to that. If it's hard when you've had pain for a long time to even accept that things can improve, but things can always improve. And I think often the first step is starting someone off just with some very gentle movement, finding a way of helping them move that doesn't trigger pain. And then it's a progression from there. Then you try different things. I work with a lot of injured sports people in the past, and it's very small steps often, where you start in water, you get them to walk in water, and then you get them to using floats to unweight themselves completely, and then move in a kind of mock running style in the water when there's no compression on their bodies at all. And it's sending that message to the nervous system that you can move without triggering pain. And that's often the first step. Now, for people who haven't got access to that, one would hope that they could potentially utilize a local pool and just, unweight yourself as you're comfortable up to, get into some deep water, holding onto the side, and just move your joints.
In extreme cases, could this even be done at the bath, for example, if people didn't know? Yes, just some smaller movements for them.
Yeah, but I think your body will tell you as well. It doesn't have to be just water. There might be certain things that you do that always trigger pain, and it's a way of finding ways of almost sending a positive message to the brain that I can move this joint without. So if you're laying on your sofa and it hurts you when you stand. It hurts your hip or your spine, for instance, when you stand up or walk up and down stairs. Well, then lay on your sofa and just, gently mobilize, have a slight bend in the knee and gently mobilize your spine by very gently rocking your spine from side to side. These such movements, although they sound very, very gentle, can be really beneficial, because, anything where you can move that part of your body without loading it in a way that normally triggers pain, can be hugely beneficial to your experience of pain in the long term. But it's a case of having the faith that it will work, and we know the evidence is there now that it does work. Another thing that is really helpful, and I use all the time in my own practice, is when you work with someone with an injury to an ankle, for instance, and for whatever reason it hasn't recovered as well as one might expect, or a knee, for instance, which is often a common injury. In the very early stages of that injury, if that person is immobilized because of they've had surgery, or they may have an inflamed knee from arthritis, or they may have an injury to the cartilage or one of the ligaments. Obviously, they're not going to want to weight bear on that too much. And obviously, if they did, then it's going to be quite painful. But what you can do is immediately start moving your other knee. Evidence has shown that if you use something called mirror box therapy, so basically you put that affected limb into a box, and on the side of that, and it can be just a household cardboard box, and on the side of that box you put a mirror, it won't take long for your brain to see that reflected image, that is reflecting back what your brain will interpret as your injured knee, but your injured knee is in that box and it's not moving. And you start to move your uninjured knee, the reflected image portrayed back to your brain will be one of your injured knee moving without pain. Now, there's a real-time example there that anyone can use that has been shown to be beneficial to the process of healing. So you can get not only less pain, but you can also get an accelerated rate of healing and recovery. And why that's important is because you can keep the nerve supply to those joints active without loading those joints and creating pain. As you feel pain on a loading joint, often the nerve will switch off or regulate down, and then you can't activate that joint and move as well as you would want to when you're injured. And that often is the case after that biological inflammation or the injury has healed. You've still got a slight disconnection of the nerve impulse to activate the muscles around that knee, if we're talking about a knee. And that's when it takes time and long times to get back. It's not because you haven't healed, it's because the nervous system, in effect, has been put on hold. And by doing things like mirror box therapy, by going into pools and moving yourself, if you are experiencing an injury or a flare of your condition, then it means you can get back to where you were more quickly once you've recovered.
Interesting.
So we're not just dealing with pain and inflammation, we're dealing with the nervous system that's actually involved with activating muscles and movement at the end of the day. Because often you can have someone who, even just thinking about movement, will give them significant and very real-time pain because their body is so used to it being painful when they move. The pain nerves have actually spliced into the movement nerves. This is obviously a quite a broad description.
Yeah.
But what that happens is that because there's an interplay between pain pathways and movement pathways, because of long-term exposure to pain, just thinking about movement can elicit pain. So we have to try and separate those two out. And that's why if you can move your body in a way that doesn't elicit pain, however small that movement is, then there's a beneficial response to that unsplicing of those two pathways.
How much of this do you think should be done under supervision as well? Because obviously some of it, when it's just like a gentle movement, there'll be some people who'd be very worried about if there's any pain coming from an associated movement, then that would worry them. They're causing more damage.
Well, I agree. And I think that, there is, your body will tell you. Your body will tell you whether it's painful or not. Because if you are doing something, trying to move your body gently, and it's still painful, then you need to kind of grade it down slightly and find something even less provocative, so even more gentle. Or you might, if you're doing it at home, you might want to think, okay, well, maybe I've got to do this movement, but do it in a supported environment like a swimming pool. Because often, if you do try and do too much and it hurts, then you're kind of missing the point. The point is you've got to try and find something, however small, that doesn't trigger pain. Because otherwise you're just feeding more pain into that movement, into that experience. Some people find it very useful just to visualize pain-free movement. So visualization, so not even moving now, we're talking about just visualization of the ability to move without pain. If you watch other people moving and you have a positive mindset, there are things called mirror neurons in our frontal cortex which fire up if we move. Now, 20% of the same neurons fire up if we're simply watching someone move. So if I watch you stand up, 20% of the neurons involved in making me stand up will still fire, even though I'm seated. So if you approach that, and you actually use that as like a dose-response relationship, if you actually say, right, I'm going to actually spend 10 minutes, thinking about me moving and it's not hurting. I'm going to spend 10 minutes maybe watching a game of football or some people walking, something as simple as that, and feeling positive about myself being able to do it in the future as well, then that's been shown as well to be certainly not a waste of time. So some people have to start from there, Mark. You have to start sometimes from there, and then grade up, and then you gradually build up to gentle movement, maybe in the pool, and eventually finding things you can do at home. This is where seeing a clinical specialist, an osteopath, physiotherapist, or some other therapist can help, because they can often, via their experience, kind of look at your history and then kind of say, well, I would suggest this movement would be a starting point for you.
One other thing that we often talk about in association with pain is like doing some exercise. I mean, we've touched on some of that already, like doing like movement-based things, but is there any other type of exercises that people should be doing to help with their pain?
So, I mean, one of the most important take-homes, I think, about exercise is that there's two main, I think, truths in the physical activity and exercise world when it comes to pain. Number one is, if we are carrying less body fat, we will have less pain in our joints. That's the truth. And it just is what it is. We all know, probably in our industry anyway, that, 1 pound of body fat equates to 4 pounds of loading at a knee.
Yeah, it's a powerful statistic, that.
It's a powerful one. If you put 10 pounds on, that's a 40-pound rucksack you have to put on, metaphorically, to stand up. And then that's going to load down on your knees. So that's quite sobering. So there's that. There's the ability to, combine activity with, a healthy Mediterranean type diet. That obviously our colleague Martin is often promoting, and I support that, because I think that's part of it. But the other thing is strengthening the joints. In strengthening the joints, what I mean by that is strengthening the muscles around the joints, because you can't strengthen cartilage, but you can strengthen ligaments, tendons, and muscle. It's unarguable now. The evidence is there that even a small percentage, a small increase in strength around a given joint will decrease your experience of pain around it. It's good to visualize it as if it's a natural brace. I mean, we all have seen those things you put around your knees if you've had an injury, or some type of corset type thing around your back that can stabilize it. But in effect, muscles around the joint can do that probably better if they're stronger. So to get stronger, I mean, there is almost infinite pathways and ways of getting stronger. But ultimately, if we think about finding ways of loading a joint against resistance, the resistance can be traditionally things like, if you're in the gym, it would be a modular machine you use to push and pull against, or it can be using weights, or if we're coming away from a gym setting and thinking about the home setting, it can be exercise bands, it can be your own body weight, etc. And all of that is equally valid. And I think the main thing to think about is that if you're going to think about strengthening your joints, then you must be regular with that. Just like, a lot of us would buy into the fact that it's probably a good thing to go for a 20-minute walk, 30-minute walk every day or every other day. It's equally valid to think about doing a 20-minute or 30-minute strength-based exercise regime 2 or 3 times a week as well.
Consistency.
Yeah, you have to have the consistency, you're right. And you have to have baseline strength also, because it's baseline strength from which all other exercise and activity choices come. That is the reservoir from which you have to feed your activity choices. So if you think, I want to take up yoga, or I want to take up Pilates, or I want to do that gardening group, or I'd like to join the choir, or I'd like to go on a rambling group, anything you care to mention, if you haven't got the baseline strength to get out of your chair and out of your house, then good luck. So as much as I'd like to say that strengthening the joints would take away all your pain, I can't. But I can tell you that having options to go into the community to do the sorts of things I've just described will definitely decrease your daily experience of pain, will improve your mood, will improve your social connectivity in your area. And all these things help with just being a human being, because it's a human being that's experiencing that pain, as well as movement always helps in the long run, we're decreasing and bringing the pain level down, even if you had long-term pain. I know that from my own experience in clinic, from my own lived experience of having long-term pain as well, and my experience with working with patients. You know, if we can get someone moving, then in the long run, they will improve. But it's that consistency, and movement comes from having the baseline strength, because without it, people's lives are really defined by the amount of strength they do or do not have. So it's very easy when you get a diagnosis of arthritis or you get a long-term musculoskeletal injury and it's understandable, it's easy and understandable actually to not think that exercise is for you. But actually exercise is most definitely for those people, because exercise is one of the things that we can all do to a lesser or greater degree and will help us all to a lesser or greater degree. It's just finding your way in to the exercise world. You know, we've got a lot of resources, as you know, that we try to do. We try to have, like, certainly in the activity side of what we do with the charity, we try to have quite a varied ecosystem, really. There's something there that you can do in a group in your area. There's something there that you can do at home on a device that you might want to download. And we've also on the website got lots of different pages that signpost to live and recorded video content that you can just kind of, you know, dip in and out of if you want to do some exercise. And all of that stuff is being curated deliberately so that it's accessible. And, you know, hopefully that people, especially people who would listen to this podcast, would identify, you know, with the people doing it. Because it's not like loads of young people in tight clothing saying, look how great I look. It's you know, it's people, you know, recognizable people that you think, okay, yeah, that they look like one of us.
Absolutely. One other thing I actually wanted to mention is something you touched on earlier on is, and it comes up quite a lot when we do things like the groups or we just talk to people, especially when it comes to pain and activity combined, is you described all the muscles like around your knee as a brace. So one thing that people do often ask a lot of questions about is the use of braces and think, you know, for your joints. So because, you know, when they're in a lot of pain, if they're moving. So I mean, I've got sort of some views around that one, but I'll be mostly interested to see what your view is on people exercising with things like braces.
Yeah, that's a great question. But there isn't really a yes/no answer to that. I think it just depends on the individual case. I think if someone is relying on that brace and they haven't tried to strengthen, then I'd always say, you know, do try, because it could be that you don't need it as much as you think. I think if someone's in a situation where that brace gives them the confidence to go out and try something, you know, goes out and do something in the community or just out and exercising, then I fully support it. But I'd also try to encourage them to expand their exercise choices slightly as well, because until you've tried and consistently tried, because it takes 3 to 6 months. We're being honest about this. If someone starts an exercise regime that has a strength element in it, depending on what your age is as well, it obviously, we all know that it becomes harder and harder to kind of, you know, gain strength, significant strength, you know, after kind of middle age, really. So as we get older, you will and can absolutely gain strength, but it does take time. And I think to really start to feel it, you should probably allow 3 to 6 months of consistent weekly training to actually feel a difference. And that sounds like quite a big ask, but in the greater scheme of things, as we all know from our experience in lockdown, 3 to 6 months can be gone in a blink of an eye.
Absolutely.
Blink of an eye.
Yeah.
And obviously, I have to caveat this advice, Mark.
Yeah, of course.
People who are kind of waiting for surgeries and things like that, because that's a slightly different conversation. You know, the conversation then is how to best manage your pain and stay strong whilst waiting for your surgery, what we call prehabilitation. There is always a point at which someone who's waiting for surgery might have to be mindful of overdoing things, because ultimately, if someone is on a long waiting list, you don't want someone to be overtraining and making their lives pretty painful, because the pain probably isn't going to improve dramatically until that joint has been dealt with surgically. And if they've been told by a surgeon they need a hip or a knee replacement. But I would still encourage them, even with that pain, to have some sort of regular movement and some kind of attempt to become stronger, even if it's just isometric work. Isometric meaning that you might just want to hold your limb in one position, stand against the wall and bend the knee slightly, is still going to be working the same muscles as if you were doing a squat. However, you're not doing it in such a way where you're going through a full range and putting loads of strain at either end of that movement. You're just holding it in one position. These things all have benefit. And then the reason why that's important for people who are looking at a long-term waiting list is the stronger you can be on the day you have surgery, the quicker you'll recover.
Absolutely.
And a bionic prosthetic joint is only as good as the muscles around it. So you don't want to be in a situation where, which I know that many people probably are looking at, where you've waited 18 months to 2 years, sometimes longer, and it would be so easy to detrain, and understandable, frankly. But if you can find a way, and this is where water becomes very important to people, if you can find a pool where you can get some kind of movement to help pain pathways and some kind of resistance from the water to build up some strength, then you'll be looking at a far better outcome for your surgery. But that's an undertaking. As a human being, speaking about other human beings, I know from my own experience that the last thing you want to do if you're in significant pain is go to a swimming pool.
Yeah.
And I understand that. But my point being, if we go back and re-listen to some of the things I've said in this podcast, it's about trying to fool the brain. Often it's about trying to move and find ways of moving without triggering pain as well. It is about strengthening, but ultimately not everyone's going to be able to strengthen the way that you could if you haven't got if you've got a joint that is due for replacement. Frankly, you might have to circle back to that kind of advice once you've been through the surgery and out the other end. Then it's time to pull the trigger on getting much stronger and consistent. But if you're looking at a situation where you are expecting to have surgery, then it's very important that you stay as strong as you can within reasonable limits. You don't want to ruin your lifestyle and the quality of life by being in constant high level pain because of the exercise you're doing. If you can kind of find a middle ground where you are moving, you're keeping those muscles active, maybe you're not doing it as regularly or as forcefully as you would in other circumstances, but you're doing your best, then you will have a better outcome.
Excellent. Thank you very much. Last question for you then before sort of wrap up is, what advice would you give to someone in pain from arthritis who kind of just doesn't know where to start? So they might be newly diagnosed, or they might have just, run out of ideas, or maybe don't have as much support as you would hope they would.
Well, I think first of all, I'd encourage them to join the charity, because, they can then immediately have some conversations with some of our staff, talking about some of the different pathways that we have, which include, as you know, the subsidized treatments with our practitioners who can give hands-on and face-to-face advice. We also have access, as you know, to a lot of resources, including, some of our great colleagues, for instance, Martin, who can help with dietary advice. We also have, access, as you well know, Mark, to, technology now, which can help most people get a bit more active from the comfort of their own homes. I think the main thing is to reach out, look into what's going on into the community as well, and seeing what's there. Are there any classes that are being run by a local authority? We have our own exercise activity directory that covers most of England. And within that, we have a county breakdown of what's going on in your area. So my advice would be, if you're newly diagnosed, this is probably the worst your symptoms will be, because I think once you've realized there are alternatives, once you've realized there are ways of being active, and there is a community out there that have a lot of shared experiences, similar experiences, who will mirror really the experiences that you're going through, that can be very, very helpful in the human experience of actually improving. And once you've got a bit of hope and a bit of a pathway, which is what I think Arthritis Action do very well, then you've got a starting point, and everyone needs a starting point, because without a starting point, it's flailing around. But I would encourage people to seek a bit of expert advice. If you're not happy with that, get a second opinion. But look at some of the stories that we often promote on our website. Go and see some of our practitioners if you've got one in your area, if you've joined the charity, and maybe engage with some of the resources as well. We've got, a YouTube channel as well, with some of our previous podcasts on there, and webcasts on there as well, webinars. So there's lots and lots of stuff to start you off.
And just to let everyone know that joining as a member does come at a cost, but loads of the other services are free of charge as well. So, whatever is available to you, if you have the money for it, great. If not, then, there's loads of free stuff on there as well. So you can find that all on our website, which is www.arthritis.org.uk, or you can email us here at the podcast, and that's podcast@arthritisaction.org.uk. And I think that's it for today. So thank you very much, David. That's been really interesting.
Great, I enjoyed it. Well, hopefully that's helpful as well. And I just encourage everyone to keep moving as best they can, really.
Excellent. Couldn't agree more. Brilliant. Okay. Well, thank you very much, everybody.
Cheers.
Bye-bye.